Hello everyone, I'm Megha Prasad with the Fits on the Go blog. I'm joined today by Dr. Klarich, who's a professor of medicine in the Department of Cardiology at Mayo Clinic and is also the program director of the Cardiology Fellowship at Mayo Clinic. Thank you so much for joining us today, Dr. Klarich.
It's great to be here, Megha. Thanks for inviting me.
Of course. Today we'll be talking a little bit about Dr. Klarich's journey to becoming a program director. First and foremost, how did you start your journey to becoming a clinician educator?
Well, I think that people that are involved in education start out with an innate interest in educating others. And I think that's something I was involved in as a resident. I was actually a chief medical resident at my internal medicine residency program. And then when I interviewed at Mayo Clinic for my cardiology fellowship, I was interviewed by both Carol Warrens and Rick Nishimura. Both at that time were the program directors. And I remember distinctly Rick asking me, "What do you want to do when you become a cardiologist?" And I said, "I want your job," meaning I wanted to be the program director, which I eventually did get. And it's been a very meaningful career path for me. I think education takes many different shapes. It takes the administration of education, which is what the program director's job primarily boils down to, but also interacting with fellows at the bedside in more informal and formal training sessions as well, all of which are really very gratifying to be involved with and enriching as a career path. So I guess I would encourage all fellows like you that are interested in education to continue to pursue that interest and that passion, because if it's a passion, it won't die and you won't become burned out doing it.
Absolutely. A lot of times fellows are told that being a clinician educator is a difficult path to embark on and may not be viable in an academic field. I personally disagree with that, but can you tell me what you think about that issue?
No, I think that academic positions take on, the physician scientist, the clinician investigator, and then the physician educator. I think those three paths are very viable and not necessarily mutually exclusive. So I would say if someone has that passion for education, they can very easily dovetail it with their research interests, their clinical interests, and those things can be blended together. There's nothing really more important than actually educating the next generation of physicians that we're going to in our profession. I think a profession has two very important things. One is to uphold the quality of the medicine that we practice, and the second thing is to engage the next generation of physicians, and education is the primary way we do that. So if we neglect the physician educator academic pathway, we would be leaving our, our, our profession really bankrupt, I think, in the long run.
Absolutely. What advice do you have for fellows that are wanting to embark on a career in being a clinician educator? What can they do starting in their fellowship and into their early careers to try and be successful in that attempt?
That's a great question. I think if you are someone that's passionate about education, then the first person you should talk to is your program director and your colleagues looking for mentors. At a place where you're training, there's often very many role models and educators that would be very interested in helping you to find the right pathways to take. I think networking and mentoring are the two main ways that you become a physician educator.
Great. I think our fellows will really appreciate that advice. Any other words on what it's like to be a program director?
Well, I think I have the world's best fellows, so I have a wonderful job. I couldn't say enough great things about being a program director. The best part about it is, of course, interacting with our fellows. There are some administrative headaches from time to time, but those are the dues that we pay to have the privilege of working with fellows, I think. So I think it's a fabulous career pathway. I think it is an academic, scholarly area. And one of the other things I would just throw in there is scholarship in education is something that's taken off. It's certainly something that is, again, like I said, you can dovetail your interest in education along with your research interests, your clinical interests. But in addition to that, I would encourage FITs that are interested in education to think about scholarship in education. And I know you've been a part of some of these efforts. And this is really important to understand what are the most effective and efficient and high yield education methods that we can use. And that's changing as our whole environment that we practice medicine in is changing. I think we'll need to flex our ideas of how we educate the next generation as well.
Well, thank you so much for being with us today. For more videos like this, please go to www.youtube.com/fitsonthego. Thank you.